Two things excite me about joining the NCI's Healthcare Delivery Research Program. The first is that the U.S. is now in an unprecedented period of interest in examining and improving healthcare in general and cancer care delivery in particular in terms of how it's organized and delivered. The second is that NCI started this program in 2015 with the stated purpose of advancing innovative research and improving the delivery of cancer care. Provided the program with great resources and some outstanding people working in this area. And I think they're poised now to make major contributions to shaping the research agenda and advancing science in this area. I think there's general agreement that cancer care should be delivered in a way that's safe, effective, patient-centered, timely, efficient, and equitable. And I think the work of our program touches each of these areas, our three branches: the Healthcare Assessment Research Branch, the Health Systems and Intervention Research Branch, and the Outcomes Research Branch. Some of the key issues and challenges facing the field right now have to do with some external pressures. So for example, we have the aging of the population, the growing number of people who will require cancer care in coming years. Unfortunately, we have a shrinking workforce of oncologists to treat those patients. We have more complex treatments, for example, precision medicine treatments. And we have rising costs of care. And all of these are working to make it more difficult to provide care for people with cancer. Over the course of my career, I've worked as an administrator, but I've also spent a lot of time as both a clinician and a researcher. My clinical work involved my role as a clinical psychologist, providing psychosocial care to people with cancer. And through those activities, I learned firsthand the impact that cancer can have on patients and their families, the emotional impact, the physical impact, the social impact, and the financial impact. We were also able to do research to find good ways to help patients through their cancer journey and applying scientific methods to identify the most appropriate ways to help patients deal with quality of life issues and manage their symptoms. So later in my career, my interest really focused on more of the sort of advanced stages of translational research, how to get evidence-based recommendations into clinical practice. So some of those challenges I think can be addressed through healthcare delivery research. If we focus on how to translate evidence into practice, we look at some of the barriers to implementing these techniques in different settings. And that's what I see as the promise of working in the healthcare delivery program, to advance this work at a national level and help set the agenda for advancing the adoption of evidence-based methods into clinical practice. In my new position, I hope we can really strive to do what the Institute of Medicine has called for in terms of improving the quality of cancer care, to provide care in a method that's safe, effective, patient-centered, timely, equitable, and efficient.